Hi friends, now I have the honor of introducing to you Dr. Mayank Bhutada. He is ranked 37 in the November 2019 AIIMS. He's a DAMS 3-year foundation course student. I'm really proud of his achievement. Mayank, how are you feeling today?
I'm feeling awesome and I'm feeling thankful actually. So many people have helped me to achieve this goal, starting from my parents, then from the AIIMS faculties also I would like to make a special mention. Then again, of course, DAMS faculties, which were the major contributors to his success. And also I'm feeling very happy. Finally, I'm moving ahead with my career actually.
I think you're sounding more relieved. Relief is the
Definitely.
predominant feeling right now.
Yes, sir.
I think, when you give the first exam and in the November itself, you're able to pass it. I think that relief helps that, okay, now the journey is, now we go to the next step.
Yeah.
Yeah. Great. So Mayank, you started your course with us in the foundation course.
Yeah,
And
3 years.
so when you entered that in 6th semester, I believe that you came to DAMS.
Yeah.
So how was your experience at that time?
Sir, we were just starting the clinical part, and also when I joined, the first concern was where to read stuff, because postings happen at their own pace, lectures happen. So where to read? So apart from standard books, DAMS notes helped. Not only in the professional exams, also they helped me a lot, and entrance, no doubt, they are gold standard. So
like, what was your approach at that time? Like somebody is a third year student listening to you right now. What should be his approach?
what should be his approach?
Like, from when you look back now and you see, what you did right at that time, what mistakes you did, maybe if you can put it together now, right? Like in third year, like how did you go about things, and what should a potential third year go, how should the potential third year MBBS go about it?
Third year, it's the start of clinical practice actually, so do not miss on postings, because I see people missing postings and that won't do any good. Practical questions are increasing day by day, so that is essential. And also, I think if I had attended foundation batch in the internship, that would not have been possible. That is the time when you have to attend, make majority of the notes and start making concepts at that point only. So that would help you in the long run also, in the professional exams, in the entrance, and that's it, because that is your clinical starting point.
Yeah, I think he's right that in third year there is a time where you can utilize that time to make notes, attend classes, so that when you reach the busier part of internship, you can select a once a day course like he did. He started with the foundation courses in the first 2 years, and then he shifted to TND in the internship.
Yeah.
Because that goes in sync with how the college is getting busier and busier. So that you can utilize that beginning of that 6th and 7th semester to your advantage.
Definitely.
And may I also ask you that when you did a transition from the foundation to TND, the major thing that changed was that in the foundation we were teaching you.
Yeah.
In TND now we are testing you and doing a discussion. Now, do you think that that transition is a good idea to do? Somebody's preparing, and do you think that also gives you an idea that okay, now the DAMS is telling you that go towards the MCQs now, more application of what you have learned, and in the initial part more theory?
Sir, actually two things happened. First, that I attended the foundation course 3 years back.
Yeah.
Will that notes help me now?
Yeah.
Updates are not there, this is not there. Am I confident, or should I just attend the regular course? So what I used to do is I used to complete the subject using those same foundation notes. Then I used to attend the TND paper, and majority of the conceptual questions I used to get it right. So it builds up confidence. Yes, you are doing it right. And whatever the updates are lacking in the notes, 3 years previous notes, they are anyways getting covered in the TND. So your notes are also getting completed. So that's kind of all-round approach.
Yeah. And same as our vision with TND, as because we know that lot of students who have done foundation with us would be in the TND. So we test them also, and plus we give them the new things that have come up in the last 3 years in that, because since subjects like PSM,
Because updates are important.
Yeah.
That
yeah,
no doubt.
like in subjects like PSM, like this time in AIIMS exam, there was so much questions on the
Yeah.
updates. So updates are important, I think.
Yeah.
Yeah, and pharmacology as well. I think.
Mhm.
And I also want to know, did you utilize that online teaching and the eMedicos platform that we have, the mobile app? Did you utilize, and were you happy with it?
eMedicos, there were two things, eMedicos and Facebook. Facebook was a little distracting for me, so what I used to do is I didn't have that app on my phone. So every 15 days I used to log in, see all the posts by the faculty. There were especially good discussions, especially in the pathology. I saw everything by Diksha ma'am or Ranjit sir. I saw their complete posts I used to see to cover the topics. And eMedicos, since this was not social media based,
Yeah.
so that I had in my phone. I used to regularly use that. Mop-up videos were good. Previous year papers are available with video discussions, which is something really important for the central institutes if you want to aim.
And what was your strategy like when you were appearing for the AIIMS exam? Like, how did you plan your revisions? How many revisions were you able to do?
Sir, frankly, I was, if in absolute terms, I would say I did only one revision, but that would not be accurate from my part. What I used to do is, suppose I'm reading orthopedics. So what I did have is, I kept my anatomy notebook on the side, and whenever suppose I'm reading ligaments from here, I used to side by side refer from here, so that automatically the revision is happening side by side. But I have to warn you that this is a time consuming process.
Yes, this is a longer process.
But on the long run,
Yeah.
it won't require many revisions.
And I think if you are a third year student or a final year student or a second year, this is a very good approach that he's saying. And that is the same approach that MCI has also recommended for this batch onwards, that is called a competency based approach. What he's saying is, when you're reading orthopedics, open anatomy on the side. But this would not work for people who have an exam in 1 month, okay? No, but people who are in third year, when you're reading surgery, open anatomy. When you're reading medicine, open physiology. You will find the correlations. And if you notice, even in this AIIMS exam, there were many questions with the integrated theme. Started with orthopedics, went on to pathology.
Yeah.
Started with pediatrics with the X-ray in the picture, and so there was a theme of histiocytosis, all those things, they're putting and they're trying to integrate. But my only word of caution here is that if you are in the last 3-4 months, this strategy would take up all your time. So you have to do this, the longer version in the initial part.
Either
then
start
smarter.
it just after profs, or
Yeah.
ideally in the foundation course itself, which I think I should have done.
Yeah, but that's a good idea. So, and in the future, I believe the 2019 batch who's entered the MBBS now, they will have to do this only, because it is written in their curriculum. When they will read anatomy in the first prof, orthopedic doctor has to come and tell.
Okay.
And like, this is already now in the vision of the government as well, I think. And that is the way forward, I believe. So, we dealt with the revision, but when you had to give the AIIMS exam, what did you do in the last 1 week?
Sir, in the last 1 week, I tried to think of what potential questions were there. Like image-based questions, they always come. Some scoring systems which were standard, GCS for example, other things. Standard things which no doubt any central institute would ask. I tried to revise those things.
And were you surprised with this paper this time that they had good number of video questions, but they were there in the May exam also?
Sir, to be frank, half of the videos were not even needed.
Yeah.
And the other half, it's good clinical questions.
Yeah, some of the questions you could actually do without looking at the video.
That's
also.
what I am saying.
but somebody might get a little worked up or confused about it. This idea. And what about the new pattern? Those 50 questions, assertion, reasoning, multiple true false. What was your strategy in them?
AR, I think from the UG time, you have some idea, but if you have read the concept, then AR you are going to get it right. That is not issue. Sequence also you have to think logically, because not every sequence you would have read in the notes or anywhere.
Yeah. the goal of sequence is actually that students tend to go towards the most common, least common. Now they say arrange in sequence. Now the error rate goes up, and they have actually penalized the arrange in sequence at a equal ratio, +1 -1. So that you should always keep in mind.
Many people left sequences in fear of negative marking, but if you proceed logically, I attempted all the sequences and got almost all of them correct.
Now, talking of attempt, like how many did you attempt actually?
I went on aggressive. Whatever question, even if I had slightest of the idea, I tried to attempt that question.
Yep. And so if we say that we had 200 questions in the exam, and we had actually 288 decision points. So on those decision points, like how many did you mark in the exam?
So among the 150 single choice questions, I left 9 of them. Rest I attempted all. And among the smaller questions, individual 288, I would say around 10 or 15 match the columns in true or false I would have left.
Okay. So that gives you an idea on the mindset of a topper, that how many they attempt and how do they go about the exam, and what was the time management that you did in this exam, like what was your targets in your mind, and were you able to meet them in the exam?
Sir, what my target was, that I thought the last 50 questions, the special questions, might be time consuming. So my aim was that when the clock reaches from 180 to 90, half the time, I should have completed at least first time reading or first attempt of all the 150 questions. I was able to achieve that target, and then I proceeded in around 2.5 hours. I completed the whole paper and then reviewed the questions which I left or marked for review. So that helps.
How many questions did you mark for review?
I didn't mark many questions for review, maybe around 10 or 12.
I think a lot of people, what they do is, it's a good strategy also that you can just write it on the back of your roll number, like these are the questions, instead of marking, because just in case you don't have time, then that becomes a very risky situation. And any particular topics that you felt were different from previous aims, like you have been analyzing the trends. And
PSM was a major disappointment for me, because I read biostats so much extensively and found almost.
So you were fond of the maths and the calculations.
Yeah, definitely. It was one of my favorites.
You could do it fast.
Yeah.
But they took off the advantage. And I think orthopedics had more weightage this time. Anesthesia.
Yeah.
And if we look at that, in ECG questions were there. In physiology, I think the graph-based questions were.
Yeah, graph-based questions were absent from this exam.
So I think that shuffling happens in the exams. The reason I'm asking all this is because I want that message to go to a future aspirant, that don't gamble in the exam. Sometimes we go with a mindset that I'm appearing for AIIMS, they will only ask me that general surgery, they'll not ask me anything else. But if you look at this paper, you analyze it, that is not true. Similarly in PSM, some people think only biostats will come, but everything else comes. So those tiny questions would help you to inch towards a better and better rank. Okay, so I think that is where that subtle shuffling is happening every exam. So you have to have some safety margin also. That don't just say that only the important topic, just that have that safety margin also should be created. And anything else that you feel that would be a utility to somebody who's appearing for the May exam? Like suppose if you were appearing for the May exam, what would you tell yourself that don't miss out on these topics?
Rather than missing out on any topics, I would say don't waste too much time reading multiple sources. I myself did it with a few subjects I know, but in the end I realized that even if I would have read this much and revised this 2 times, I could have made 2 more questions correct rather than going extensively.
Do you think that making notes in that 3rd year that you did those classes and the foundation course, making notes, that made a big difference in the end when you were so busy?
Actually, that is the reason I am selected, I must say. So the notes are the gold standard. You must have some place where which you can trust, which you can read at the end every time anyways. So anyways, what I used to do during my 6-7 semester or 8-9 semester, if I found something in the standard textbooks which felt important, I used to add in those notes only. So even if a clinical question comes, my notes are already updated with that.
And how did you maintain your mindset throughout the year? Like were you always sure that you'll do it, or there were times when you were unsure, dips? Like how was the year like, and how did you mentally manage it? Because success also has to do with the mindset.
Getting in the first attempt is not something you can guess. Likely you never imagine that you are getting, because internships are also busier, departments are there, so you already think. So many students, my friends, what they did, they stopped studying. They said ki I will attempt the next after internship I will study for the 6 months and then I will attend. I thought I should at least start. I have the notes prepared, I am attending internship, and also I have some free time, so why waste that time? I started reading, attended T&D, and in the end I got the benefit.
Yeah, and I think that is a good strategy.
Quitting due to busy internship is not a good option.
And I also, like to add here that every year people tell that, internship is busy and I cannot study, but you will also find same kind of people who will be topping the exam also with busy internship. So you have to put that belief onto yourself that, I have the belief that I can do it. And plus, when you were studying from 6th semester onwards, you've been attending classes, making notes. Why not utilize them at the first go itself?
Definitely.
And plus, that rank also gives you confidence that I'm on the right direction. And another thing I have observed is that suppose in internship you say that I'm not studying, but you will give the exam, and if the rank doesn't come good, that shatters your self-beliefs. Even if you have not studied, but that belief is hit.
And will I be able to get
now that
good rank in the next
now you have to spend those 15-20 days telling yourself no I can do it, and then that time gets wasted. So it is important to hit the exam hard whenever you're giving it. There's no point in a half-hearted attempt at any time.
This is the time you are most in touch with clinical as well as theoretical aspects, because many clinical questions were also there which were not in the notes, like the heparin in the syringe, Allen's test and all videos, thyroid examination methods. So and you have to be in touch with clinics.
And another thing that is that those things, if you are able to apply, and I want to add here that May and November exams have a slight different touch to it. The November exam kind of favors the people who are just passing out with their some common things that he would remember, and the May has more theory intensiveness to it. So that also is there. So you have to know which exam you are appearing for. You have to look at the previous papers, analyze the topics, look at them, and you have video solutions for everything. Your teachers are analyzing for you. Please don't miss out on the previous papers before AIIMS. I think that is very critical.
If you have not solved previous years, then I don't think you will score good.
Yeah, because then you will be surprised by the paper, and you don't want to be surprised. You want to have an idea what the exam would look like. I think it is critical. And even for PGI Chandigarh and JIPMER, I would say the same thing. Central exams, have a feel of the exam before you give the exam, so that on the exam you're not surprised by the way the paper is spreading out in front of you. So I believe that you've done very well in organizing everything. Now is the time to motivate others by saying something motivating.
So just believe that yes, you can do it. Busy schedule, don't take this as an excuse for anything. Trust your notes. Whatever you did maybe 3 years back, maybe 2 years back, maybe even in the first and second semesters, if you have made some conceptual points, read that. Those are not going to change, and those are already in your long-term memory, because whatever you read in the last 2 months, you might not have covered everything, you might not have covered every concept. So whatever you did previously is also important, and attending T&D also I feel is important, because getting updates is T&D is the only way to get the updates, I feel.
Yeah, especially when you have done the classes, so you don't want to sit in the class again because you already done them, you made notes. Now
and in
T&D
internship also
kind of
you might not be able to attend all the classes, maybe few if you can manage.
That is where, I think many years back I personally coined the term TND, and because we had at that era that students started who had done classes with us, so we had to devise a course for them. So then we came up with an idea that they need to, because somebody has done a regular program already, classes already. Now what for them? I'm very, very happy to meet you, and I'm very glad that we could have this discussion today. Mayank, I also want to know that what branch are you seeking to take?
I'm interested in surgical disciplines, so maybe I'll opt for general surgery.
Let's hope for the best. Let's hope for the best for the counseling. I wish and pray that you get the branch of your choice.
Thank you,
and
sir.
I'd like to take this opportunity to congratulate your parents as well. I'm sure they must be very proud of you today.
Definitely, sir.
Heartiest congratulations.
Thank
God
you.
bless. God bless.